Good morning. This is Dr. Ara Dukmajian, CEO and founder of the Duke Spine Institute. It is Thursday, July 20th, 2023. And our first surgery for today that will be live streaming for you is a cervical herniated disc, degenerated disc, stenosis, radiculopathy. This patient presents to us from Texas, and she has basically had a fusion in the past, which you'll be able to see on her x-ray. Yeah, can you see the x-ray, Henry?
Yes, we can.
All right. Yeah, so she's had a fusion, and if you count from number 2 down, so 2, 3, 4, 5, 6. It's 5, 6 that was fused, and she has problems above her fusion now with stenosis. We're going to go in. She did not want another fusion. We're going to go in today using the endoscopic technique and a laser. We're going to clean up the back of that disc as much as we can to get some pressure off the nerves and give her some relief of her pain. All right. Let me know when you're ready.
All right.
Are we ready? Let me, before you do that, let me just start by gaining access to the space. So to do that, we're going to place a needle, spinal needle, above her prior fusion. Shot? That's really good. I could probably be a little bit higher. Shot? All right. Still a little lower than I want to be, so I'm going to move up just a little bit. Shot? And shot. That's pretty good. Let's get an AP. So I'm going to start with a lateral x-ray view, then I'm going to move to a front back called an AP. Anterior posterior view. Shot. I want to make sure we're in the middle. Oh yeah, we're way past the middle, which is good. Shot. That means she's got good mobility of the soft tissues. All right, good. Shot. That's about the middle there. All right, lateral view. So you can see I've displaced the trachea and esophagus over. Shot. And we're still right there. Now this disc is pretty collapsed. Shot. Just below it. Shot. At it. Shot. AP. Now you can see I'm trying to line my tip of my needle up right with the disc. Quick AP. Shot. I want to make sure I'm in the midline, which we are. Now lateral. That looks pretty good. All right, let me just see. Yeah, there we go. So I'm going to take my hand out and I'm going to advance the needle through the disc. And it's going to be tough. Little inline traction. There we go. It's working. Huh? Yeah, felt it go. You felt it go in. Yeah, I felt it go in too. I was just talking to my anesthesiologist, so that's good. All right, everyone relax. So far on the side view of the neck, you can see through the x-ray that we are in the middle of the disc at C3-4. All right, so we're going to do a discogram. Now, this is not the kind of discogram we do with lumbar or thoracic where we verify the discs are the cause of the pain, because our patient's asleep. She can't verify anything. She has a tube down her throat. This is all done under general anesthesia. Cervicals are always done under general anesthesia, general endotracheal we call it. That way the patient doesn't move during the surgery, and I get good relaxation of the muscles. Now I learned this technique overseas in Korea. The Koreans were the first to do cervical, and a German surgeon, Dr. Roten. Shot. All right, so I'm going to inject a little bit of dye, and we're going to get a discogram. What I predict we're going to see is in the back of the disc there's going to be a tear where the herniation came out. Shot. There it is. All right, perfect. Get it. Go there with the arrow. Henry, you see that tear back there?
Yes, we do.
Big tear. Big tear, big herniation. That's our target, folks. We're going to leave the rest of her disc alone, and we're going to go in the back, and we're going to fix that spot. All right, we've done our, let's get an AP just to show the audience the front view. You'll be able to see the dye leaking out through the foramen, the neuroforamen, at the back of the disc, right where the nerve roots are. Perfect. Show the neuroforamen on both sides. You could see tears on both sides. You should not see that black dye over there. That is called the neuroforamen. No dye should ever leak out there. The fact that it's leaking out there to the sides where the nerves are tells you that there's a herniation, annular tear herniation. All right, so far great muscle relaxation, and I thought it would be a lot harder getting into this disc, but it's actually been pretty good. By the way, feel free to ask questions during the surgery. Shot? So we're going to be fixing 2 discs today. This is the, what is this, 3-4, 2, 3, no, 4-5? We're doing 3-4 and 4-5. Everyone agree? So the first one we're doing is 4-5. I've already infiltrated the skin a little bit. We're going to make now a 4 millimeter incision. Now the alternative surgery for this patient would be to have her whole neck fused. And she didn't want that. That's why she came from Texas. She's watched our videos. She knows that these are safe outpatient procedures. I just made a 4 millimeter incision. Now I'm going to leave the guide wire and I'm going to remove the spinal needle. Shot? But I got to monitor all this on the x-ray, because if you accidentally pull the guide wire out while you're doing this, you got to start over again. Shot? All right, you can see the needle's out, guide wire is still there. Shot, you can see the guide wire. Perfect. All right, so next we're going to bring our dilator down over the guide wire. People ask me at times, is this FDA approved? Absolutely. Everything we do is FDA approved. By the way, Duke Spine Institute is currently located in Melbourne, Florida by NASA. We're about 15 minutes from NASA. NASA is in the space shuttle people, the rocket launching people, SpaceX, Blue Origin. They're all here on the space coast of Florida where we are. And we have a lot of people that come from overseas and other countries and other places around the United States for our endoscopic surgery. All right, can you see the incision, Henry, right there?
Yes, we can.
We've had about 4 or 5 drops of blood, that's all. Shot? All right, you can see, did you take a shot? Show us the tip of the dilator in front of the disc. Yep, there's the dilator tip right in front of the disc. Good. And then let's get an AP view just to make sure we're in the midline. You don't need to pull yet, Dr. Berndes. Shot? All right, looks good. So we're a little bit off to her right, which is fine, because that's the side we want to go to. Her right side is the worst side. And the good news is, with one incision, we're able to treat both sides of the disc. And the reason for that is we do what's called like a windshield wiper move. If you think about a windshield wiper, it's fixed in one spot, but the other side moves left and right across your windshield. Shot? So we're going to be doing the same thing. The business end of our tube is going to be able to windshield wipe back and forth, left to right, behind the disc. Shot? All right, looking good. We're making great progress here. I'm going to go ahead and take the guide wire out since we're inside the disc at this point, and we're going to advance the dilator to the back of the disc. Look at that. It's opening the disc space. Pretty cool, huh? You can see the air in there. This is, you know, from a neurosurgeon standpoint, this would not be an air head. This would be an air spine. Shot? Are we getting good traction? All right. Shot? She's very degenerated at this disc. So we are treating degenerative disc disease, which is basically an arthritic collapsed disc. But this is where her worst herniation is. So I got to make it to the back of the disc just a little bit further. That looks pretty darn good to me, okay? So at this point, we've lost about 7 or 8 drops of blood, maybe. Less than 1 cc. If you were to do a fusion on her, she would lose anywhere between 20 and 100 cc's. We're going to lose less than 1. So this is a relatively bloodless surgery compared to other types of spine surgery. Shot? Okay. Vital signs are good, my anesthesiologist has said. We need to mic up Dr. Berndes. Right?
A lot of people in the comments have been mentioning that.
Yeah, they want to hear from the anesthesiologist. They want to ask you questions. Shot? They want to know more about you, Dr. Berndes, your opinions. You should feel honored. Yeah?
I like it that people are interested in anesthesia.
Yeah, of course. It's the other side of the coin, right? The anesthesia. Okay, we're just gradually, slowly advancing the tube down to the back of the disc, through the disc. And I've shown you guys this before. It could look like the tube is taking up the whole disc, but it's not. It's only taking up about 15% of the disc. And again, I'm sliding the tube over. Are you giving me inline? Yeah. We're making our way to the back of the disc. All right, I'm going to advance the dilator just another millimeter or two. Shot? Shot? Uh-huh, perfect. And now I'm going to advance the tube over the dilator. Shot? This will probably be my last advancement here. Shot? Just because we're really at the back of the disc. Shot? Just want another millimeter and we're good. That's as good as we're going to get. All right. Come on out. We're going to place our what's called the fluid adapter. Ready? Yep. Little inline. Oh, there we go. Good. All right. So far, so good. So to this point, folks, I want you to understand, we've made a tiny incision. 4 millimeters. Now, the alternative surgery, which is a fusion, would require a very big incision. Go ahead. Can you see this, Henry?
Yes, we can.
And the reason is we would have to expose a large area of the neck because she's had the prior fusion with lots of scar tissue. So she would have a big incision. And it's not the incision that people are terribly concerned about. It's really what happens below the incision. All the damage to your swallowing tube, your trachea, your muscles down there, the nerves, they're all getting cut with the fusion surgery or artificial disc. But with the Duke laser disc repair, we're not damaging any of the soft tissues under the skin. And that's why these patients can go home an hour later, and that's why they don't need narcotics after surgery. If you're having a fusion surgery or artificial disc, you're going to have to take Percocets or oxycodones afterwards because it's going to hurt so bad. Okay? With the Duke laser disc repair, a lot less pain because we're not doing trauma to your soft tissues underneath. That's not part of the surgery. I need a... All right, so here's the back of the disc. The blue stuff is the dye we use, and it stains herniated disc that's degenerated. So remember, there's two types of disc down here. There's going to be normal disc and there's going to be herniated. There's a piece of herniation right there. Okay? There we just floated up. And the way the laser works is it releases the herniations, and then the tube provides a conduit or a passage for the herniations to leave the body, and we collect them out here. All right. Here's the back. You can see some redness there from inflammation. Now I gotta move around a little bit and try to get some more of the herniation out.
So then we're gonna really test it too.
Why?
Oh, because it collapsed there.
Oh, her? You know, even though she's collapsed, it's not as bad as we've had some of the other patients. But you're right. Yeah, Luis was just talking about how challenging it can be to treat a degenerated disc. It is challenging. You guys can see bone spur there. Yeah, it is challenging. You know, sure, we all want an easy herniation to treat, like a big disc that's easy to get into with chunks of herniation and nothing else. That's the ideal situation, but unfortunately, when it comes to treating human diseases, you rarely get the ideal situation. And we're used to treating degenerated discs. We've done a lot of them. All right. So Henry, why don't you run the video that shows how a disc herniation can cause pain? Since a lot of people with disc herniations in their neck, well, they have pain. And that's one of the things we're trying to fix is their pain with our treatments.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
Okay, welcome back. Now you can see a lot of our patients that have herniated discs in their neck really have a lot of pain in their neck, and pain is important for us to target and try to get rid of, okay? Like the other vital signs, pain is something that should be within a normal range, and you know, blood pressure, heart rate, respirations, they all have normal ranges. They're vital signs. Well, pain should also have a normal range, and that should be 0. They call pain, what is it, the 5th vital sign or 6th vital sign? Dr. Berndes?
Yeah, pain can alter all the other vitals.
Yeah, pain can alter the other vital signs. So,
High blood pressure.
yeah, it makes blood pressure go up, respirations go up. So, pain can affect all the other vital signs. So, it's an important one. And that's what our focus at Duke Spine is. We primarily treat pain. Okay, and we find ways to cure it.
It also causes chronic depression and other symptoms.
Yeah. Dr. Berndes is adding in that it causes depression and anxiety and all kinds of other psychiatric issues. So it's true. It does. But what I'm getting at too is that there's other reasons to do surgery on discs like this besides pain. And the most common is what's called neurological deficits. So neurological deficits are when the patient has weakness, numbness from a pinched nerve or pinched spinal cord. By the way, this is all calcified posterior longitudinal ligament, okay? And I'm just checking to make sure there's no herniation. I don't see any. I want to get out to the foramen and see if there's anything out there. When we first came in the disc, we got a bunch of herniation coming out, but right now I'm not seeing a whole lot. I'm seeing a lot of scar tissue. I'm seeing some bone spurs for sure. Some of them we need to remove, others we don't. Any questions from our audience?
No current questions.
And you all can see the laser, right? It has a blue plastic around it. But the actual laser fiber, the important part of the fiber, it has two parts. It's got a plastic coating that's blue, and then it's got a glass fiber inside there. You guys see the glass fiber? Right?
Yes, we do.
That glass fiber is only half a millimeter wide. So that's the scale that we're working with, half a millimeter. The blue stuff is about a millimeter, so if you look at the width of that, it's 1 millimeter. So when we do this kind of surgery, okay, don't expect to see big changes on your MRI. Why? Because what we're doing is we're actually treating microscopic disease, but we're treating it strategically, right where we want to get it, okay? This is a strategic type of surgery. By the way, this is a herniation right here. Then it's too big to take out of the tube by one big piece, so I got to break it up and cut it into little pieces with the laser. See that? Sometimes I just have to sit there and keep hitting the herniation with the laser to get it out. If you make it small enough, a lot of times it just floats out. That's what I'm hoping for. Any questions from our audience?
No current questions.
All right, let's show the audience the video on how the Duke laser disc repair actually works.
The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. We're just working on removing pieces of herniation from the disc. There's another one here. A lot of scar tissue here affiliated with this piece of herniation. See that? See the white stuff right there by the laser, right there? That's the end of the posterior ligament, posterior longitudinal ligament, which sits behind the disc, right in front of the spinal cord. A lot of scar tissue, that's what this stuff is here from inflammation. I'm not as concerned about that scar tissue. I don't think that scar tissue is doing anything to bother the patient. Some scar tissue does, other doesn't. Why, temperature not good?
She's a little cold, but I'm also thinking the probe is right where you're working to, so it's getting a little cool by the irrigation.
Could be.
I think it's just good to check that we have the bear hugger on. Medium high.
Looks like a little cockroach floating around. Nothing we can do on the irrigation, huh? Let me try to grab it again. Any questions, Henry?
No current questions.
Not even for Dr. Berndes?
Unfortunately, no.
All right.
Oh, we just got a question. This comes from Canes25 on YouTube.
Huh. Gaines 25. Nice to hear from you today.
They said, "Good morning, all. How is your thoracic patient from Tuesday doing?"
Thoracic patient from Tuesday is doing fantastic. He had no thoracic pain at all in clinic yesterday. He's already gone back home. He may be staying locally still. Yeah, there's definitely not enough irrigation. Okay, is it going? Because I don't see much irrigation here. It'd be important to turn it on. I still feel like there's no irrigation, guys. I'm not sure why. It's barely dripping out. It's a little bit better. We got to do something about the irrigation, Louis. It is a little better. Yeah, it's definitely better now. All right. Yep, thoracic patient's doing fantastic. I believe he was the last case, right?
Yeah, he's from Puerto Rico.
Yeah, from Puerto Rico. Yeah, he had no pain. We also did his lumbar disc at the same time. All right, let's flip it and we're done with this. We'll irrigate it. Hopefully get that little guy out of there with some irrigation. Let's have a grabber. See if I can grab it out. Yeah, looks good. This is the last of the tear that needs to be debrided. A little piece of herniation there. And remember, these discs are never going to go back to looking normal. I get people asking me that, you know, should we get an MRI after the surgery? Why? MRI doesn't tell you where pain comes from. MRI doesn't tell you if you've removed the source of pain. The patient will tell you. So the key is to make the right diagnosis in the beginning. There's a big piece of herniation right there. I need to get that out. I'm going to try to grab it out. If I can't grab it out because it's too big, watch this, then I need to try to laser it into littler pieces. Nope. I feel it, but it doesn't want to come out. Remember, the inner diameter of the tube is around 2.8 millimeters for the cervical. So we don't have a lot of working room here. So getting these herniations out, you have to sometimes cut them in pieces, like I've been doing. Once you cut them, they get easier to get out, usually. I think this is going to be the last of the hernia. This is a big one, though. A really big one. Yeah. Take that. just doesn't want to come out. The softer a herniation is, the easier it comes out. The harder and more calcified herniation, the harder it is to get out. So these are really old degenerated discs with lots of calcified, scarred herniation. All right, any questions from our audience?
No current questions.
All right. This blue stuff here is more recent herniation. Watched an old movie last night that I really enjoyed called Hidalgo. Anyone seen Hidalgo? Huh? Yeah, well that's why I watched it, because I saw it when it came out many years ago, but Hidalgo, it's about a Mustang and a cowboy that went overseas to race Saudi Arabia. Great movie with Viggo Mortensen. I haven't seen him in movies lately. Oh, he's a great actor. I think the last movie I saw with him was Eastern Promises. Great actor. All right, I think we're pretty much done here. I don't see any more herniation or bone spur that needs to be removed.
It's a great movie. You get a chance to see that one.
Sound of freedom?
Great acting. Oh, we good?
Yeah, we're done. All right. Her neck looks good, nice and supple. There's no hematoma. We're going to be putting in a little antiseptic.
I think the new one that's coming out, the Oppenheimer, looks like a good movie.
Oppenheimer?
And they were
Yeah.
talking a lot about it on the news.
Yeah.
The atomic bomb.
Yeah.
History of crime.
I'm going to see that one for sure. All right, we're going to now move from the C4-5 disc up to the next disc, which is the 3-4. Okay. So before I take the tube out, I'm going to want to get an x-ray. Let's go, Jordan. And this is called the Duke Spine Slide. We call it the Duke Spine Slide. And the reason we call it the Duke Spine Slide is we're literally sliding out of this disc. Can you watch this, please? To the next disc up. Shot? All right, we got some tube in the way. All right, so we're going to move along the surface of the bone. It's still bone spur, so it's tricky. We got to stay, there we go. We got to stay right in front of the spine. Okay, so I came out of the disc space. I need an AP coker. We're going to get a front back view to make sure I'm still in the middle of the spine. And quick shot. So I'm off to the right a little bit. I want to correct that and go off back to the left a little. Shot. All right, there we go. It's a little too much. Shot. That's pretty good right there. We're right in the middle. All right, we're going to move up to the next disc. Now, compared to the one we just fixed, the disc above is not quite as degenerated. Perfect. So we're almost there. Just right there. Shot. Let's see what that does. I'm hitting a bone spur. Shot. So I'm going to angle up and go in. Let's get an AP, make sure we're in the middle. mallet. That's perfect. We're in the middle. Everyone holds things still. Hold the neck. And that looks pretty good right there. Yep, shot. Yep. Shot. Give me a little extension. Yeah, shot. That's nice. Shot. Just about where we need to be. Shot. So I'd like to do a discogram. Again, the same time, it's called a chromodiscogram rather than shot, an evocative discogram. An evocative discogram, your patient's awake. You're looking to evoke a response. Shot? All right, that's good. Just had to get the disc material out of there. Let's see if we can get a discogram. Sometimes we can't. Shot? Oh yeah. That's it. You can see the tear, guys. Look at the tear. Show us the tear. There's the tear causing her symptoms right there. We're going to go clean that up. So nice job. Shot? Uh-huh. See how we're going right into the tear? Shot? All right, that's perfect. We're right at the back of the disc. We're going to bring the tube down. And for those of you not seen this before, the entire surgery, folks, the reason the incision is 4 millimeters, the entire surgery, Henry, you see this?
Yes, we do.
It's being done through a 4 millimeter wide tube. That's the beauty of this endoscopic surgery. This is true endoscopic spine surgery. Unlike what other doctors tell you they do endoscopic spine surgery, they don't. Okay? Slight extension, yeah. Give me inline traction. Shot. That's it right there. All right, here we go. Shot. Yeah, thank you. It's definitely going in easier when you give me a little inline traction. Very abnormal spine. Obviously, if you look at all the bone spurs and arthritis, you're going to say, wow, it's bad. You're right. However, we're not here to fix all the bone spurs and arthritis. We're here to, number one, eliminate pain coming from the disc. Number two, decompress nerve roots and spinal cord. Everything okay? Yeah, that little extra made a difference. All right, so I see the dilator moving back, right? You don't want to allow that to happen. We're going to pull the dilator back a little bit. Just a little bit. Shot? Perfect. Because if you allow the dilator to advance with the tube, you can end up hitting on the spinal cord and causing a damage to the spinal cord. Shot? Which we really don't want to do. We're here to protect the spinal cord, not hurt it. All right, that's about as good as we're going to get right there. I'm happy with that. Let's get the fluoro out. We're right at the back of that disc. You guys see that where the tube is?
Yes, we do.
Yeah. All right, very good. Neck is looking good. There's no hematomas. Any questions from the audience, Henry?
Yes, we have a question from Teresa on Facebook.
Teresa, welcome to our live stream.
They said, "Hi everyone, I have neck pain and weakness, numbness and pain in my legs. I also have hand and arm pain with numbness. C4 and C5 right base disc osteophyte combined, thickened / buckled ligaments, flava due to effective spinal
Luis,
cord."
We need to strip it. Somehow the tip is missing.
No, you're
All right,
good.
so
Sorry, your phone went off. Well, I was still finishing up.
light on.
The small one, please. Thank you.
Go ahead.
So yeah, the C4 and C5 right base disc osteophyte combined thickened / buckled ligaments flavor.
We don't do that, Teresa, here during broadcasts. We don't sit there and go over your individual problems and make a diagnosis. So I appreciate you have an abnormal disc in your cervical spine. And the way to get help and advice, a diagnosis, recommended treatment is to submit your MRI for us to review. And it's free. It won't cost you anything except your time. You're going to have to fill out a form and then upload your MRI. And then we'll schedule you for a meeting where we do 10 minutes and basically I'll tell you exactly what's wrong and how to fix it. We do this all the time, every week. We've done it for thousands of people around the world and it's a free service for you. So that's how we do it. But basically, this live stream session, question and answer, is really more general questions about spine rather than specific, what's wrong with me, how do you fix me, okay? That said, I don't think your leg symptoms are related to your herniated disc in your neck. I could be wrong, but you may have problems in your lower back as well. So if you don't have a MRI of your lumbar, you'll need one. But certainly if you've got an MRI cervical, upload it and fill out our form. Henry has put the link there. And feel free to set up a meeting and I'll be happy to review your MRI, show you where the problems are. Part of the reason we don't rely on reports by radiologists is the radiologists are wrong about 95% of the time about what's going on. And besides, the radiologist will never tell you why you're having your symptoms. They just tell you what they see on the MRI. So it's my job to make sense of it, right? Like anything in life, you need interpretation. You need an interpretation, and the radiologist will put interpretation on the report, but it's meaningless to you because those structural abnormalities have to be correlated with your clinical symptoms.
And the physical exam.
Yeah,
They don't examine the patient.
that's right. And your physical exam. So Dr. Berndes is piping in, and he is 100% correct. Your physical exam, your clinical symptoms, and your MRI all have to be considered together. And it's not your MRI report, it's your MRI images. These are big herniations here, by the way, lots of them. Again, this is a degenerated and herniated disc. So it's not just a herniated disc, it's way past that. It's a degenerated disc. We call that spondylosis. Spondylosis. It's a medical term, and it really means collapsing of the disc, drying out of the disc, loss of disc height, bulging or herniation, annular tear, dehydration, and basically a loss of movement, normal movement as well. You get a restricted movement. It also includes scarring inside the disc, like we're seeing scar tissue right here, this white stuff. Now, what makes the scar tissue happen is the inflammatory response to the herniation within the tear. That was discovered at Duke Spine Institute. We discovered it many years ago. There's the spinal cord down there. You guys see that little window right there? Right there, that's the spinal cord. I'm literally touching the spinal cord with the laser tip, all right? I'm not turning the laser on, that would be bad, but I'm cleaning the herniation near the spinal cord right now. And this stuff is all pushing on our spinal cord, this herniation. We've already removed this stuff here because remember, you bring the tube in, a lot of times you're kind of center in the back of the disc, so we remove that. Look at the foramen. You guys see the dark spot there? That's the neural foramen opening. And we're going to go in there. See the herniations coming out of there? That's what causes arm symptoms, weakness, numbness, tingling in the arm. Okay? So we're going to go in there and we're going to clean that all up. This is, again, scarred up PLL, posterior longitudinal ligament, for those people that understand the anatomy. And this is the right C3-4 foramen. And there's the dura down there, the white thing. That's where the nerve root is. That white thing is the nerve root. I'm going to the other side. There's a herniation coming out. So we've removed a lot of herniated fragments. And the important thing here is that you can see the herniations are not one piece, they're many pieces. Okay? They're not one piece, they're many pieces. So when people say I have a herniated disc, you don't have one herniation, you have many at that disc. Oh, come on, Luis, we need to get this stuff right so I don't have to fiddle with it. So when you say you have a herniated disc, what you're referring to, a herniated disc, singular, is the disc you're talking about is herniated, but it has many herniations, not just one. All right.
I was going to say something about the neuro exam.
The neuro exam, yes, Dr. Burnda.
26 years of being an anesthesiologist and seeing how neurospine clinics work, I've never seen a patient examined more than this clinic. That was one of the things that I
Yeah.
the first day I came to visit.
We got to get Dr. B a mic. Henry, are you able to integrate two mics or just one?
I could definitely look into that for sure.
Yeah, because maybe when one's talking, the other one goes off, so you have one feed, but you know, whoever's talking gets that feed, I guess. Let's look into that.
Copy that.
Dr. Berndes was commenting that in 26 years of doing anesthesia, working with spine surgeons, neurosurgeons, this is, by the way, a huge herniation in the right side. This is what's causing most of her right side symptoms in her right arm. Okay? This is the foramen, and this is a calcified, look at that, calcium. It's about to be released, what's left of the herniation. I've already removed about 60%. There's a little bit left. Come on out, boys. Come on out, get out of there. Dr. Berndes is saying in 26 years of doing anesthesia, he's never, all over the country, he's never seen such a thorough examination being done as we do at Duke Spine, okay, by the surgeons, by the spine surgeons. What he's doing is he's saying that we're very thorough in figuring out, using the physical exam to figure out what's wrong, okay? Everybody thinks, oh, I got an MRI, that's going to give me all the answers. No, it's not. That's why, you know, MRIs are misinterpreted all the time by surgeons, by radiologists, by people. And yes, the MRI is a very important tool when you're trying to figure out what's causing spine pain or radiculopathy. However, huh? You have to use it in conjunction with the exam. I agree. Yep. So it's not everything, folks. It's only part of it. It's kind of like trying to bake a cake with just flour. You're not going to be able to bake a cake with just flour. You need all the ingredients. And Duke's...
Flour is just the interpretation of the MRI itself, but
Yeah,
it doesn't have anything else in it.
that's right.
You're missing a lot of the ingredients.
You're missing a lot of the ingredients if you're just working with flour. You're not going to have a very good cake that anybody wants to eat. We got less than 5 minutes.
Icing on the cake is the DLDR.
Dr. B, 5 minutes? Probably, 5 minutes. I'm telling my anesthesiologist we have 5 minutes because this patient is under general anesthesia, meaning that they're getting gas anesthesia. So we got to turn the gas off so the gas starts leaving their body, otherwise they'll never wake up. If the gas concentration in their body, well actually at the brain, stays the same as it is while they're sleeping, they'll never wake up. So I'm telling my anesthesiologist, hey, time to turn off the gas and start waking the patient up because we're almost done. Great questions, by the way. Feel free to ask more. Now, she's going to have some discomfort after the surgery because we're doing such extensive removal of scar tissue and bone spurs. It's normal to have pain. Everybody that wakes up from this surgery in the recovery area in the first hour says they have pain across the base of their neck, into their shoulders, and that always goes away. It just takes time. But this is all herniation. This disc was definitely worse than the last one. Now the last one was more degenerated, but this disc, I believe, is causing more symptoms. Just look at the amount of herniation and scar tissue and calcium. All the gold is calcium. Hey, what's going on with my irrigation? Are we good? This is it right here. This will be the last herniation right here. That's my irrigation. I feel like it's gone. All right, so you guys got to keep an eye on the irrigation. I can't float these things out. So you guys see when the irrigation stops how the herniations don't float out? They just sit there. So I need my irrigation to help float them out. Very important. It's a hum-de-dum moment. All right, there we go. Guys see that? That was kind of a good illustration. So you guys could see it. So it's not just the laser that makes this surgery work. It's a combination of things that we do. Some of it we talk about, some of it we don't.
Thank you, Yoda.
My son said to me the other day, Dad, can't surgeons just do the surgery by watching your videos? I said, well, they're going to kill a lot of people trying. It really requires training. I know I make these surgeries look easy. Huh?
This is not for telemed learning.
Yeah, you can't learn telemed learning. Yeah, this is not a telemed residency or fellowship, Dr. Berndes points out. Dr. Berndes has had some really good comments this week. We don't do cosmetic spine surgery, he's right. We're not here to make your spine look good. We're here to make it feel good. And then, of course, this is not telemed residency. I like that. Dr. Berndes, I'm going to have to give you a new title. Funny guy, right? Comedian. Duke Spine comedian. I thought I was funny. Man, I think we have some stuff in there still. Herniation, look at that. I just have to be super careful because it's right on top of the nerve root. So, don't want to get too carried away. All right, that should be it right there. See how I can float it out if I do it just right? Yeah, very nicely done. Okay, one more piece. Yep, now we're getting bleeding because we've decompressed the nerve root and there's little veins and arteries in the foramen. All right, that's good. I'm happy with that. Any questions from our audience? Lights on.
No current questions.
We're going to show you just how small this whole surgery is done. Now there's only probably at most 5 surgeons in the world that can do anterior cervical endoscopic disc surgery like this. Okay? There's far more that can do lumbar, probably in the hundreds, but in cervical, there's probably 5. And there's definitely none in Australia, none in Africa, none in India that I'm aware of. There's none in Europe, and I think I'm the only one in the Americas. So maybe it's quite a bit less than 5. And we're done. I'm going to take this out. So really, we probably, Duke Spine is the only one in North America, South America that does it. Thoracics, I'm the only one in the world that does it, transforaminal thoracic endoscopic. So we're really the only in the world for cervical and thoracic, pretty much. And for lumbar endoscopic, there's far more because lumbar is easier to do, safer. But nobody does the Duke laser disc repair but us. And it's our technique that allows the elimination of back pain from the disc. All right, so 4mm incision. I don't know if you guys can see it because
Yes, we can.
her chin's in the way. But it's about 4 or 5 millimeters. Maybe I got a little heavy-handed, 5 millimeters instead of 4 millimeters. But no bleeding. We lost less than 1 cc, so I'm going to call blood loss 1 cc. And we were able to accomplish all the goals. Luis, you got it? Thank you, everybody. Great work. 1 down, 3 to go, right? And the next one is what? Thoracic? Lumbar thoracic. So lumbar and thoracic. So we're doing a couple of discs. Make sure, Luis, we prep, you know, high and low. So, all right, any questions, type them up. I'm going to come answer them for you face to face. It's been a pleasure. Yep. Thank you, guys. Thank you.
Good morning, I'm Dr. Ara Duke-Majan, CEO and founder of the Duke Spine Institute, here with one of my patients who traveled from Mississippi.
Yes, sir. Oxford, Mississippi.
Oxford, Mississippi, which I've never been to Oxford, Mississippi, but I'm sure it's a lovely place.
Very nice.
And why did you come to Duke Spine Institute here in Florida?
I'm having issues with my lower back, shooting a pain all the way down towards my elbow, as well as having a little bit of stumbling while I'm walking within my left leg. And went to other physicians to look at my spine, whatever, and they wanted to do fusion and all kinds of other nonsense that I thought maybe there might be a simpler way, a process of doing things. Did a lot of research and found Dr. Duke here.
And what do we do for you?
You guys did a C3, I think 3-4-5-6 at the Duke laser disc repair surgery.
And before surgery, you had neck pain?
Correct.
For how long?
It's been ongoing probably for about 5 years.
And then pain going from your neck into your right shoulder, down your right arm?
Correct, just getting progressively worse. And that's kind of what made me finally to say I got to definitely do something about it.
Here we are less than 24 hours after your surgery, the Duke laser disc repair. You can see the incision right here, it's 4 millimeters. Good morning, I'm Dr. Ara Duke-Majan, CEO and founder of the Duke Spine Institute, here with one of my patients who traveled from Mississippi.
Yes, sir. Oxford, Mississippi.
Oxford, Mississippi, which I've never been to Oxford, Mississippi, but I'm sure it's a lovely place.
Very nice.
And why did you come to Duke Spine Institute here in Florida?
I'm having issues with my lower back, shooting a pain all the way down towards my elbow, as well as having a little bit of stumbling while I'm walking within my left leg. And went to other physicians to look at my spine, whatever, and they wanted to do fusion and all kinds of other nonsense that I thought maybe there might be a simpler way, a process of doing things. Did a lot of research and found Dr. Duke here.
And what do we do for you?
You guys did a C3, I think 3-4-5-6 at the Duke laser disc repair surgery.
And before surgery, you had neck pain?
Correct.
For how long?
It's been ongoing probably for about 5 years.
And then pain going from your neck into your right shoulder, down your right arm?
Correct, just getting progressively worse. And that's kind of what made me finally to say I got to definitely do something about it.
Here we are less than 24 hours after your surgery, the Duke laser disc repair. You can see the incision right here, it's 4 millimeters. And do you still have that neck pain and pain in your arm?
No, sir. Zero pain.
Gone?
Gone. Completely gone.
Cured?
In shock. Results better than I actually anticipated, which is a good thing, right? That's what I'm here for.
Well, I'm not shocked. It's what we expect to see typically, which is good. The procedure works, and that's why we do it. It works better than anything else. Were you offered any other treatments?
Yeah, they wanted me to go look at a, what do they call a spinal deformity doctor. And they possibly looked at like doing rods and pins and, and all that kind of good, the fusion and everything. So it just kind of...
Why didn't you want to do the fusion option?
Long time recovery time and just more of a difficult surgery.
Yeah.
Much more difficult surgery. And me working at a house, I still want to have good quality of life in the future.
Yeah. Well, fusions have complications, a lot of complications. Scar tissue, bleeding and pain. Are you having any pain right now from the surgery?
No, not at all. Just a little stiffness when I turn left to right, but that's par for the course.
Yeah, the stiffness is going to take some time to work out.
Sure.
You've had bad arthritis in your neck, your discs were degenerated. You had degenerative disc disease and herniations and bone spur at C3-4, C4-5, C5-6. We went in and fixed all three. You will need therapy to increase the range of motion. It'll take time and you'll get better. Are you happy with your decision to come to Duke Spine Institute?
Very happy. I flew all the way down here from Oxford.
Yeah, very good.
So absolutely made the long trip. I fly back Saturday. And I feel much better flying on the plane than I did earlier. Just thinking, I'm not on any kind of pain medication, none of the muscle relaxant. There's zero pain, so I feel more comfortable hopping on that plane.
And we did it all through a 4 millimeter incision. You could actually see the incision with the little tube going in to your discs. I moved the tube from one disc to the next, and we went back to the back of the disc where the tear was, and I cleaned the tears up with the laser. So I'm That usually does the trick of getting rid of the neck pain when it comes from a
Okay.
herniated disc. And of course, we unpinch the nerve roots that were going down your arm. So that's why your arm is feeling better as well. I don't expect any of that to come back. You
Okay,
should
great.
be pain-free the rest of your life. Just don't
Fantastic.
re-injure the discs.
Absolutely. I'm definitely glad to get my quality of life back. That's the number one thing.
Anything you want to tell your audience?
Anybody that's dealing with the same issues I have, I definitely recommend to come to the Duke Institute of laser surgery. It's a wonderful thing.
All right. Well, congratulations.
Thank you
Safe
so much. I
travels
appreciate
to
it. Thank
you
you
and
so
Dad.
much.
And if
We
you-
will.
Yeah.
Well, my dad lives in Tampa, so my wife's up there in Oxford taking care of her stuff up there. So
Okay.
worked out good to have my dad here to pick me up and drop me off at the airport tomorrow.
All right. Sounds good. Well, safe travels for you then.
Thank you so much. I sure appreciate it.
My pleasure. Good morning, I'm Dr. Dumajan. It's December 9th, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact,
Yes, sir.
and he is suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes,
as a matter
sir.
of fact.
Yes, Doc. Yeah.
You're here now on post-op day 1. It was outpatient, no hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, Doc. I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, it's just a game changer. His procedures, because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now on my back, and Dr. Dukes is going to fix it next week, so I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed, but you broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can
Yes, sir.
actually see right here in this video footage how small the incision is, tiny. And I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, Doc.
100%.
100%. And doctor did. They did surgery on 3 different levels, and through a really small hole.
4 millimeters.
Yes,
4
Doc.
millimeters. Incredible.
There's no stitches. It's just a Band-Aid.
Yeah.
That's crazy. If you have a fusion for 3-level fusion, I don't know how long that would be, but it's
It's
terrible.
about that long
Yeah.
for a 3-level fusion. And then of course you'll have swallowing trouble for months.
Not
And
good.
then you'll have pain and you'll be on narcotics. Are you on any opioids or narcotics?
No, Doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Duke laser disc repair, you don't have to worry about getting addicted to painkillers because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. Well, is there anything else you want to tell your fans out there before we wrap this up?
Yeah, I just want to let my parents know and my 10 younger brothers and sisters, if you're watching this, if you have back issues, you need to come see Dr. Duke, because he is one of the only people in the world that can do this procedure, and it is a game changer, and it's well worth it. At least give him a review. He'll do a free MRI review for you. It's just do your research. Go to his dukespine.com, look at his website, and just do your research and give yourself a chance to do the right thing.
Well, thank you. And yes, now I'm the only one, but someday there will be another one
You hope.
who will be doing these
Yeah.
surgeries,
Yeah.
and probably better than me.
Okay, thanks, Doc. Appreciate
Thank
your
you,
help.
sir.
Yeah.
We'll see you soon.
Yeah.
I'm Dr. R. Duke-Majan. I'm here with one of my patients on February 1st, 2023. And you just had surgery on your neck, the Duke laser disc repair done with a 4mm incision to fix 2 herniated discs, her C6-7 and her C7-T1. And you had a long neck. We were able to get down to the C7-T1, and she had a very large herniation there. So your surgery was about 24 hours ago. How do you feel today?
I feel like a different person. I feel I was able to do many things this morning that I haven't been able to do for 4 months, and that is just get out of bed and just take my first steps and have 0 pain. And I haven't had that in 4 months. First step out of my bed was always the beginning of my day, and it was awful. And today I took my first step out of the bed and it was glorious. Good
for you. And before surgery yesterday, you had been suffering for about 6 months with neck pain going into your right arm, correct?
About 4 or 5 months.
How did that affect your quality of life?
Every day is difficult. I mean, I have a 10-year-old and a 5-year-old boy, and just the basic duties of a mother every single day was just unbearable and difficult. So quality of life was not very good. And so it is now.
And so the pain, obviously, because of the pain, activities would set it off, so you were limiting what you were doing. You were limiting what you were able to do as a mother.
Yes, there was things I were not able to do, and be the best mum that I can be was not one of them.
Well, you look very happy right now.
I am.
Why are you so happy?
Because I'm pain-free.
Yeah, and you didn't have to have a fusion or an artificial disc put in your neck, did you?
I did not.
Did anyone offer those surgeries to you?
I did. I was offered those surgeries. I was told that I needed a fusion, the possibility of disc replacement in 1 or 2 years down the road, but it was my decision to go in and have those taken care of if I wanted to. But there was also a possibility that once the doctor got in, that he could not replace those 2 discs, so he'd have to fuse those 2. So that to me was a possible 3 fusion, 3 discs being fused. Mm-hmm. And I know the consequences of that, so that's why I came for your opinion, in your professional opinion, what can be done in a less evasive way. Or that was an option for me, and here I am.
And I'm really happy it worked out for you. You can see in the video, we were able to get down to C7-T1, which is really a first endoscopically. And, because you had that nice long neck, we were able to do it. And there was huge pieces of herniation down there. Your other disc was more degenerated, and we were still able to get that fixed as well. So I'm very happy you're doing well. What's life going to be like now that your neck is fixed?
My quality of life is just going to be a lot better than what it was. I'm going to take it easy, and I know that I need to take it easy, and I'm going to be careful, but I'm going to wake up with a smile on my face now instead of tears.
Well, congratulations.
Thank you so much.
Is there anything else you want to tell your fans out there?
Come see Dr. Duke. He'll fix your pain and make you walk out with a smile on your face.
Excellent. All right. Good to see you.
Thank you. Thank you so much.
Welcome. It is February 23rd, 2022, and I'm here with one of my patients who's traveled from Kansas. Is that correct?
That's correct, Wichita, Kansas.
Wichita, Kansas, and clearly you've had surgery. We just did it less than 24 hours ago. You've got your incision there on your neck. How are you feeling today?
Much better. Much, much better. 26 years ago, I had a fusion of C6 and 7. They told me in Wichita that I would need to have fusions of C4 and 5 and C5 and 6. They set up the surgery for the 23rd March, and I'm going, I can't wait that long. This thing hurts, it's killing me, I cannot sleep, and so on. My husband Dale did a whole batch of research online, and he says, I want you to be able to move your neck after surgery.
Yes.
And
I did
he did a lot of research, and we found Dr. Duke to be a man of integrity. He films all of his surgeries. He puts many of them online, and you can see for yourself all the good work that he's doing, and that he really, really likes to help people. What he does is generally not covered by Medicare and not covered by some other insurances, but it very well should be. because it really helps people.
So what was life like for you before surgery?
My pain was mostly in the neck and shooting down my shoulder, and especially in my shoulder.
And you had really bad weakness with your arm. You couldn't even lift your arm, right?
That's
before
correct.
Surgery?
That's correct.
Show us what you can do now.
Before surgery, I could lift it to about here, and now I can lift it.
All the
Yeah,
way up.
just the next day, right
You couldn't
after.
do that before.
Yeah, that's because she had a herniated disc, two of them, C4-5, C5-6, and the herniations were literally sitting on the nerve. And we got in there, and if you watch this video segment right here, you can actually see there's the laser, and as we're removing the herniation, it literally pops right out of the foramen where it was sitting on top of the nerve, crushing the nerve. So, and the surgery was a success. We lost almost no blood at all, and you can see your incision is tiny. And here you are one day after surgery. It was outpatient, and you're ready to go home, right? You guys flying
Going
back
home tomorrow.
tomorrow? Okay, very good.
Try and enjoy a little bit of Florida today before we go back to the snow.
Okay, it is snowing there, huh, in Kansas?
Probably.
Okay.
If not today, then tomorrow.
Well, stay another week.
And yesterday it was 70
I
degrees
wish.
there.
70 degrees where, in Kansas?
Or maybe that was the day before it was 70 degrees, and
nice.
then they woke up to about 11 degrees.
Ah, so the cold front came in. We get those from time to time, and it gets cold around 60 degrees. But most of the time, it's very pretty here in Florida. Well, we're glad you're here. Is there anything else you want to say to the world about herniated discs in the neck and surgery?
Dr. Duke will give you a free look-see on the MRI. It's well worth your time. And he will do a Zoom call with you and tell you what he can do for you. So go for it.
I said that it was so important that I said I'd pay for it. You know, because you know, we got a little bit of a nest egg, and sure it's going to cost a little bit, but it was worth it because we got results. I mean, that's amazing.
Your health is the most important thing in the world, people's health. So
You can't take it with you when you
yeah.
pass away.
All right, folks. We'll have a safe travels back.
Thank
Great
you.
to see you. Glad we can help you out. That's a nice.
Thank you.
That's a nice shake. This is Dr. Duke Major. I'm here with one of my patients who underwent the Duke laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. And it just took a long time to recover from that. So this was much, much better.
Your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, you know, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was
You can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Duke and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations.
I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
Dr. Duke Machen here at the Duke Spine Institute. I'm with one of my patients who's traveled to us from Mississippi. And he came here for the Duke laser disc repair to be done for a herniated disc on his neck. And he's now here today, just one day after surgery. How are you feeling today?
Feeling great. Feel like the weight of the world has been lifted off my shoulders. Feels a lot less pain in my shoulder, no more tingling. Feels like my body's trying to recover back to normal. I think the surgery went very well. No problem whatsoever.
And you're just one day after surgery. Can you tell whether the neck pain is gone yet?
The neck pain is gone, and the pain throughout my shoulder, the tingling, everything is gone. A little soreness in my throat. My voice is a little harsh, but other than that, I feel great.
Awesome. Can you show us your incision? Oh wow, look at that. So you have a 4mm incision. You can see that right here on the surgical footage of the endoscope. We actually, when you watch the video, you can see all the herniated discs back there. We were pulling them out one at a time. You had about 20 pieces. And then you can see the nerve root right there in the foramen. And there's no herniated discs anymore on the nerve root. We got them all out of there. I had to open up the posterior longitudinal ligament and get all those fragments of disc herniation out of the epidural space that were pushing on your nerve. And I got a good look at everything and it looked fantastic. So I think you're gonna do great. Did you consider having like a fusion surgery? Did anyone offer you fusion before?
Yes, I was offered fusion. I was told that was the only surgery that could be done. I started Googling. I come across the laser surgery and I decided to give it a try. And I don't regret it. I think it was the best decision I ever made for my age, and I think the outcome would be a lot more better in the future. And it was a great experience. It really was.
And you work with metal as your job, so you didn't want metal in your neck, on your spine.
No, I think the cold weather would have had an effect on it. I think it would have caused an adjacent effect, is what they call it. When you do the fusion, it make the disc below it or above it wear out. And I'm 34 years old, and if I live another 30 years, I just feel like it would cause significant problems. I think the laser is the best thing out there to help with this type of surgery. It's all legit. That's all I can say about it.
Good morning, I'm Dr. Duke Machen at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain. So what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day. And I feel great.
And I feel wonderful for you for doing that. That's okay. Well, sorry it's taken me so long to get here, but we've completed the surgery and everything went very well. We did 2 discs in a patient with what's called adjacent segment disease, where you do a fusion, which we didn't do, somebody else did, and then the discs above or below the fusion wear out and become symptomatic. Adjacent disc degeneration is where the discs wear out on the MRI. Adjacent disc disease, so there's disease and there's degeneration. Degeneration doesn't mean they have symptoms. It just means it's a MRI finding or an X-ray finding where the disc above or below the fusion is collapsing. Doesn't mean they need treatment. It means that they have a structural abnormality seen on diagnostic imaging. That's all. When you have disease, it means you have symptoms from that abnormality, okay? And that's the big difference, and that's what somebody asked me earlier. They were asking about their MRI and having a bad disc in their neck and symptoms. So associating or ascribing specific symptoms, medical symptoms, to a condition seen on diagnostic imaging, that's the art of medicine. That's the magic of medicine. And that's what Duke Spine does better than anyone, okay? We've had many years of experience doing it, and the proof is in the pudding. I always say our treatments are directed at our diagnoses. Our patients do very well because our diagnosis is correct and our treatments are state of the art. All right, so this patient, we have a question from somebody who's a viewer, and they're asking,
Can bulging disc be repaired with the same procedure?
all right, and who's asking that?
NPFD F68RC on YouTube.
NPFD F68RC on YouTube. Thanks for asking a question. The answer is absolutely. Bulging discs do cause symptoms in many patients. They can cause pain in the neck or back. They can cause symptoms down the arm or legs. And we can fix a bulging disc with this surgery. As a matter of fact, a bulging disc is the perfect disc problem to fix with this Duke laser disc repair. Because if we fix the bulging disc, it's early on, it'll prevent further degeneration of the disc. Great question.
And then the next one, I mean, it's not really a question. I'm sorry, I'm trying to make sense of it. This comes from Judy on Facebook, and they said, I'm just reading this, I had my to me that you ordered yesterday. They will send you the written. I will pick up the discs and written tomorrow. Then I get the discs from me is I will call you.
Okay, well, I think we understand what you're saying, and I'm looking forward to meeting you virtually and figuring out what's wrong and looking at your MRI together. For those of you who are not aware, we do what are called free MRI reviews, and basically we expect you to go onto our website. We have a form you fill out with your name, phone number, email, so that we can contact you and coordinate a meeting, virtual meeting on Zoom. We found Zoom to be the most effective way to do this. And basically, you'll get 10 to 15 minutes with me directly face to face, and where I can examine you and talk to you and get information I need to figure out what's wrong and how to fix it. Once I've done that, I'll explain to you the treatment I recommend, and then at the end you get to ask me questions. So there's really 4 objectives during the meeting, and at the end your questions will be answered, basically. So I look forward to seeing you.
And that is it.
All right, hope you enjoyed the surgery. We'll be back in about 30 minutes with the next one. It is a patient getting lumbar and thoracic Duke laser disc repair for bulging herniated discs.